When you send someone to collections for not paying their bill, we also need to terminate them as a patient. Now, that's another reason I am having no issues with getting rid of a patient, with terminating a patient. If we went through all the steps, we went over our financial guidelines, we attempted to collect the balance, and unfortunately, we were unable to do so, then sending them to collections is absolutely necessary. One thing to keep in mind is that if you threaten to send a patient to collections, you really actually cannot do that repeatedly. So there's actually laws about that. So if you send a patient to collections or threaten to, you don't follow through, that's actually considered harassment. I plan on having some accounts receivable experts coming onto the podcast at some point so we can discuss this, because I know that this is something that a lot of people use as sort of a, almost like a prod to pay the bill, but you can't continually threaten someone with collections. You only really have that one chance to do it. If a patient is not going to pay their bill, we need to send them a letter, and we also need to document how often we're contacting them about it. Well, thankfully, you are able to do that with your electronic systems because we are able to track how often we're sending them statements and did they even open the email if we sent it to them via email. I had a secret weapon actually, and it was a form that was called the authorization to file suit. It was a triplicate form. And for those of you that were born after the year 2000 and have never seen this type of thing, triplicate means 3 copies of it. So you could press through the paper and basically fill out this form all on one. So the top form would go to the patient. Then I would keep one of the other ones for my records. And then the third one would go to the collections agency that I'm using. Now, basically, whenever I sent that letter to a patient, it would say right on it, notice of authorization to file suit. Well, that was always a huge wake up call. And I had lots and lots of success with patients paying their bill when they received that type of letter. So unfortunately, the environment of practicing today means that the collections laws around healthcare are just very different than they were 10 or 15 years ago. Medical bankruptcy, medical delinquency, and healthcare, their bills, the billing and the laws around them have changed a lot. I'm not going to go off topic, but there have been many changes, and it's not as easy, or actually it's not as shameful as it used to be. It doesn't affect your credit like it used to. And so a lot of people are realizing that it doesn't hit their credit, and they actually count on that. And so if you know that it's not going to hit your credit, if you're a shady type of person, what's basically going to happen is they're not going to pay their bill. So when I send the collections letter to them and inform them that it's going to an agency, that is the point when I send a termination letter to them to let them know that we no longer want them in the office. Now, when you send the notice of authorization to file suit, that's kind of like shots fired, right? Most patients don't come back after they see that because it's a very legal looking type of letter. And you can have your print company do that. You don't even have to have it in triplicate, but basically you can come up with a form that says that. I can always link to a copy of it in the show notes so that you know what I'm talking about. Now, let's get back to the termination letter. So the letter that you're sending states that they have 30 days to visit your office to complete any work they wish to have done, and it's on a cash only basis. Now, here's the essential part. We should never, ever leave a patient in an irreversible state. So you may send someone to collections in the middle of working on a crown, but you have to deliver the crown. You can't hold on to the crown because they didn't pay their bill. That's leaving them. It's a definition of leaving them in an irreversible state, right? So I hope that makes sense. We can't withhold records too. That's another thing that we'll get into. So because of this, we need to, if you know you're going to be sending somebody to collections, we need to stop treatment at a point that doesn't leave them in a worse state than before. And if somebody is delinquent paying their bill, like say they have a huge treatment plan and they're already defaulting on the first 5,000 of it, don't push and schedule those extra appointments. That's it. Call it a day. So complete the existing treatment and basically don't talk to them about completing more treatment. The more you make appointments for them, that's actually enabling them not paying the bill. So deliver the crown, deliver the partial, whatever you're doing, but don't start anything else unless they can pay you on a cash only basis. Okay, so that's the important thing. Many of us feel that our PPO contracts aren't going to allow us to do that. We have to file, we have to do this, we have to do that. However, there's a clause in all of these contracts that says the office must make an attempt to collect from the patient. This is part of your attempts to collect from them. Now, I'm not suggesting that you use this as a loophole, right? That's not the intent of it. But if you reach the point of sending them to collections, I'm going to guess that you have done everything that you can in your protocol. So your protocol of giving them 30 days on a cash only basis, if it's part of your financial policy, that is considered part of your collections process, and you are allowed to do that. In my experience, we rarely have patients come in to finish any work during that 30-day period. They just get that letter, and I think most of them already know that they're not going to pay this bill. You know, they could be embarrassed, they could be angry, they may simply not have the cash for treatment. Whatever the reason is, we provided them an option and they chose to not take it, which is fine with me because now, I'm not going to get emotional about it. Now I just need to know what to do. So I send the termination letter certified. I attach a return receipt request so I can make sure that I know when it arrives. And if it comes back to me because they didn't pick it up, I scan it into my records. I keep a record of the fact that they didn't pick up their forms if they request their forms. If this goes to small claims court or elsewhere, the fact that they didn't pick it up could help your case. Your collection agency would like to know that you had no contact with them as well. It could mean that they changed addresses, they moved out of town, and collection agencies typically can do what we call a skip trace. One question that I receive in management classes is whether we have to give them their records. Yes, you do. They own the records, right? I know we're holding them. It feels like we own them because we're holding them, but you don't. They're their records. And honestly, why would you want to keep them? It seems petty, but you know what? I understand pettiness. I get it. We might feel this way because the person didn't pay their bill and we worked really hard to collect it. I chuckle a little bit at that because I understand, but we have to give them their records. Now, in your documentation, there is probably a section to record missed appointments, canceled appointments, or treatment non-compliance, okay? Those are actually clinical notes. And I know if you've heard me speak recently, you know that I'm very passionate about if the patient decides to not move forward with treatment, that's a clinical note. But we don't include financial information in clinical notes. So the fact that they defaulted on a bill, that doesn't belong in clinical, but missing an appointment, no showing for an appointment, and even late cancellations, those are clinical notes because those are actions by the patient that affects the treatment. The treatment could have been provided, but it wasn't due to the patient's what they call lack of participation in their own care. Now, collection agencies and lawyers use this concept frequently, so don't get upset about the records if they request them. Just send them. Would you like to hear more? Follow the link for the full episode.